But if a woman has not slept properly for, let's say, for 6 months, and if she's having a panic attack and waking up at 3 in the morning constantly, and that is not kind of an endurance, that is like a torture. Doctor, I just want a good sleep. Hormones are not the real culprit during menopause. Panchakarma in your late 30s and early 40s is the servicing before the journey of perimenopause and menopause. Hormone replacement therapy is like firefighting. Panchakarma is more like a preparation to prevent a fire outburst. In today's episode, I want to do this as a follow-up to my previous topic on menopause. But this time, I want to focus on whether Panchakarma can be a substitute for hormone replacement therapy. See, I see this in multiple consultations, where the patients come to me and ask, Doctor, I want to know what is your opinion on hormone replacement therapy. See, I am an Ayurvedic doctor and I do not prescribe hormone replacement therapy, and that is not my training. But hundreds of menopausal and perimenopausal women who come to us for Panchakarma at Sitaram have asked the same question. What is your opinion? Should I take hormone replacement therapy, and can I avoid it by doing Panchakarma? And many of them are slightly confused because their personal gynac would have told, please take it. It will prevent so many problems. Or let's say one of her closest friend who could be a purist, extremely against any allopathic drug or a chemical entering the body, would say, please don't fall for it. It is dangerous and maybe you could get a breast cancer. There are even some research that suggests it. And about this particular research, I will talk about it because it's not the full truth and it is unusually fear-mongering. So today, our duty is to understand where Panchakarma can help and where HRT will help. You see, a woman who's waking up at 3 in the morning with a panic attack and night sweats, and because of this excess sweating, she's changing her bed sheet. At that moment, she's not concerned about whether something is natural or not natural. She's asking, can somebody please help me? So we will deep dive into this without confusion. So first, let us understand why the fear of hormone replacement therapy exists. The fear came from a big study in the year of 2002, and it's called the Women's Health Initiative. And that study averaged women in their 60s. It was designed to test whether hormones could prevent chronic disease and not to test whether HRT helped menopausal women. But what happened? Those findings got carpet bombed onto every menopausal woman, and regardless of their age, formulation or their dose. And what it did, it scared people away from HRT for more than 2 decades. So I've spent the last decade watching the fallout of that. See, where women are terrified of a treatment they might genuinely need, and women were terrified out of a treatment they were already on and doing well with. So the newer research shows that when HRT started within 10 years of menopause, the risk picture looks very different from what that 2002 study suggested, especially in younger, healthier women. But the public message that reached women back then was very simple. Hormones are dangerous and they could cause cancer. See, once a public message like that goes out in few lines, the nuance is lost. So for many years, women were scared, even doctors were scared, and many women suffered, like hot flashes, night sweats, broken sleep, mood swings, and they were told, you just need to endure it and it'll just go away. You see, now enduring is fine if the symptoms are mild or even moderate to tolerate. But if a woman has not slept properly for, let's say, for 6 months, and if she's having a panic attack and waking up at 3 in the morning constantly, and that is not kind of an endurance, that is like a torture. So some women sit in front of me and you can see it in their face. They're not asking for, oh, I am aging, I want to look beautiful and I want to run a marathon. They are asking for a basic necessity. Doctor, I just want a good sleep. Sometimes they say, Doctor, I wake up fully drenched. Small things at home trigger me and make me explode. Sometimes I open my mobile phone and forget why I opened it in the first place. This is what we call as brain fog. And I don't feel like myself. And these are the words that they keep telling. See, for a woman in this stage, I recommend please go and have an honest conversation with your gynecologist about hormone replacement therapy. Sometimes after starting it, I've seen women who respond as if it is black and white. They finally find their life back. And most importantly, their mental health gets back normal. So let us understand. Hormone replacement therapy can be a lifesaver when symptoms are severe, when sleep is terrible, in case if there is vaginal dryness that can impact the intimacy with their partner. But now what is happening? The pendulum is also swinging on the other way. Like some voices are now saying that every woman should be on HRT. And they come with the narrative, it is so good for your brain, your bones, your skin, and it will keep you very young, beautiful. And if you really respect yourself, please do consider taking hormone replacement therapy. See, that is another polarized version. See, no medical intervention should become a fashion. Whether it's HRT, Panchakarma or Ashwagandha or Shatavari, anything used without understanding, it becomes a real problem. So the point that we are trying to say here is the hormone replacement therapy is not a villain, and it is also not a magic tool either. It's just a tool. Now the question, where does Panchakarma become important in menopause? See, for that you have to understand one thing. Menopause is not a sudden event. It is like a continuation. It's like a transit to another journey of your life. So the body that walks into menopause is the body that a woman has been creating for the last 10, 15 and 20 years. And if for that last decade, let's say that last 5 to 10 years, sleep has been poor, too many coffees, maybe double espressos at midnight, food is irregular, stress, and let's say the recovery is also minimal. Also, maybe there could be a borderline burnout. That menopause arrives carrying all of that baggage. So hormones are not the real culprit during menopause. They are the trigger. But what menopause exposes is what was already there. I have actually watched a twin sisters where one had to take HRT and other did not need it. The one who didn't need it had done Panchakarma earlier, had corrected her routine, and had taken the perimenopausal years quite seriously, where she was very invested in her health. So same genes, different paths in and different transitions. Now this is not a scientific proof. So this is my clinical observation. But when you see such things again and again, you start respecting the preparation part. Now let us picture a different woman. She's in her early 40s, not yet in full perimenopause, but she started noticing few things. Let's say her periods are changing, her sleep is not what it used to be, lighter sleep, and she's getting irritated more easily, and her belly fat is getting more, and the body is shifting. Now this is the woman I really want to reach out to, because she is at that intersection, like where she's not yet in that crisis, but she still has that time to not go there. Now think of it this way. See, people who live in cold countries, before the winter arrives, they put on the winter tires to their automobile. See, they prepare the car. Or let's say you're going for a long mountain drive. You service the vehicle. You don't wait until the engine starts smoking on the highway and then ask, where is the mechanic? But this is exactly what we do with our body. We ignore the signs for years, and then when the body starts shouting, we say, doctor, can you do something quickly? See, Panchakarma in your late 30s and early 40s is the servicing before the journey of perimenopause and menopause. By doing Panchakarma, there is a scope for metabolism to get corrected, the sleep routine to get re-established, stress coping gets properly trained, and from an Ayurvedic side, what happens? The VATA gets balanced, the Pitta is brought down, and the Ama, the metabolic load is cleared up, and the tissues are nourished. And what happens after Panchakarma? A routine settles into her life, the food is corrected, and when she integrates strength training with the right trainer and proper recovery with yoga, pranayama, mindfulness, that entire trajectory where she could go into a very rock bottom hitting menopause, it completely shifts. So this is where a 2-week Panchakarma retreat earns its place, not as a substitute for hormone replacement therapy, but as a preparation. In my practice, I've had the privilege of watching multiple patients come across an entire decade. Some came in their early 40s and kept coming back through their perimenopause, menopause and postmenopause. So I've seen that full arc. So I'll give you a 3 broad types, and where HRT is the best, and where Panchakarma will be very beneficial, and where they don't need both either. See, the first is the woman in deep crisis. It's like severe hot flashes, sleep is destroyed, mental health hits rock bottom, panic attack, anxiety, depressive bouts, something like, she lost her sense of like herself. So for this patient, please go and consult your gynec and talk about the possibility of using an HRT. See, I want to say something here that women don't always hear from an Ayurvedic doctor. When the mental collapse is severe, HRT often acts almost like a psychiatric support. It lifts the depression, it restores sleep, the confidence comes back, and even the entire family feels, okay, now we are back on track. Because when it impacts the woman, it can impact the whole family if she is living with a family. So this is not something Panchakarma can replicate when somebody is already in that, hitting that rock bottom place. See, for this woman, the fire has to be put out first. And after that, we can talk about long-term work. Now, the second type of woman. This is the woman with mild to moderate symptoms. Some heat, sometimes sleep is slightly disturbed, uncomfortable, but not yet like in a crisis. See, for her, Panchakarma can do a lot of good work. So a lifestyle change can also, contribute along with that. So HRT may or may not be needed depending on how things progress. So this is the gray zone where individual evaluation matters most. And the third type is a woman who has like what I call a walk in the park. It's a walk in the park kind of menopause. Some warmth, sometimes there is a shift, but she has a easy transition. These women are usually not lucky. Actually, they are often the ones who knowingly or unknowingly were already living in a way that supported the transition, or they had a good hormonal balance going in before that transit happened. See, I have treated patients who underwent Panchakarma while they were still on the hormone replacement therapy. And I have found that to be one of the best models when symptoms are intense or fluctuating. So it's like the HRT manages the immediate symptom load and the Panchakarma does the underlying work. So I work with few gynecologists who prescribe hormone replacement therapy and refer the same patient to me for Panchakarma. They tell me, please give her the support alongside, and the vice versa. I've seen perimenopausal women while doing Panchakarma, they are not able to handle the severity of the hot flashes or night sweats, and I tell them, please go and check with this gynaec and get prescribed with HRT, and then we can do this together. And that way they are able to get a right transition into the post-menopausal phase. So my honest summary, I do not have a fixed answer. I will not tell you HRT is good or bad. It depends entirely on where you are, what your symptoms are, and what your risks are. And also we need to understand at what stage you are in. See, hormone replacement therapy is like firefighting, and Panchakarma is more like a preparation to prevent a fire outburst. Both have their place and both can be misused when turned into this is the only way forward. So if your symptoms are severe, please don't suffer in silence. Because someone told you HRT is dangerous, please don't do that. Go and have that conversation with your gynaec. The science around HRT, it has matured significantly, and it is not that dragon it was made out to be at one point of time. So if you're in your early 40s and still in quite good shape, please don't wait for this crisis. Especially if there are some hormonal pattern that you're observing which is changing, sooner the better to do a Panchakarma. See, everything I've shared today is for awareness. So please don't take it as a personalized medical advice, but you get an idea and talk to your own doctor before making any decision. Because these problems, it deserves clarity and not just some random noise that you keep hearing from WhatsApp and social media. So if this helped, share this with a woman in your life who is sitting in that confused place right now. And that is how these conversations move. I hope you enjoyed, and I'll see you in the next episode.